Hello and welcome to Self-Help UK's BAME Health Roadshow. We're here today at the Karemia Institute Mosque, one of 5 stops that we've done along the way in our churches, in our community centres and of course here at our mosque. The message of these roadshows is to talk about health. Let's be healthy. Let's do it in a fun way with some yoga and some Zumba. Let's also have some checks done while we're here. We can have our blood pressure checked, our diabetes, and we can also just have some chats about prostate cancer and bowel cancer with people who have actually gone through it. So let's go and see what's happening inside and let's really start talking about health.
Welcome, Wilma.
Thank you so much for having us.
Pleased to have you in the Karemia Institute.
You're Dr. Musharraf and you're the Imam here at the Karemia Institute.
That's right, yes.
Yeah? And tell us a little bit about the Karemia Institute.
Well, the Karemia Institute is about helping the individual and the family to develop their personality, their morals, their social and their spiritual values so that they can be really happy themselves and make others happy and successful. What you're doing here is really wonderful because you're trying to educate and make the community more aware of what is available for them really. A lot of people sadly will not know most of these wonderful institutions there are in our society that are ready to help.
And that's the kind of message that we're trying to give people here today. You know, prevention is better than cure, isn't it?
Absolutely.
Shall we have a little look round and see what we've got here today? We've got blood pressure checks here, diabetes checks, cancer screening.
Yeah, those are really critical because a lot of people take health for granted.
And what health message would you like people to leave with today?
The health message is a very simple one. Take care of your bodies. And, in this country we have a fantastic health system. And let us take advantage of that, use it for, giving ourselves a better health. And better health, will give us real happiness.
And that's a lovely message. Thank you for having us here today and thank you for speaking with us. And let's get those messages out there together.
I'm a community heart stroke TIA nurse. The TIA bit is transient ischemic attack and that is a small stroke. The theory is, or the fact is, that a small stroke, the symptoms have passed within about 24 hours. A major stroke, the symptoms will last much longer and the recovery time is much longer. Our remit is to see patients or clients within a community setting, usually within their own home. The patients that we see will have been in hospital with either a cardiac event, so we're talking about heart attack, or they will have perhaps had cardiac surgery. They may have had a heart transplant even on the rare occasion. I do feel that events like this are really, really important from several points of view really. Just as an example today, I've picked up a couple of people who've had very high blood pressures that wouldn't even register on the machine. The other good thing about an event like this is that it gives me the opportunity to deliver brief intervention around such issues as smoking cessation, alcohol reduction, increasing exercise, and all those things that encompass keeping a person well. I feel that self-help groups are really, really important. It gives people the opportunity to have a contact with someone who's potentially in a very similar situation. So it helps that you've got somebody to speak to. You feel less isolated if you know that there's somebody out there with the same condition.
We're having 5 health roadshows across the city and I feel that it's really important because a lot of the time people say people in the Black, Asian, minority and ethnic communities are hard to reach, but of course we're not. We're where we've always been. We're in the community centres, we're in the churches, we're in the mosques. It's really important to bridge that gap between the health services and the community because there's amazing services out there. We've got the City Care team here doing diabetes checks and blood pressure checks. We've also got Action for Blind doing eye checks. If you want to get into a sport, we've got archery going here. And then we've got some yoga tasters as well, and many more of the services like Macmillan, British Heart Foundation. And then we've got lovely self-help groups like Friends and Brethren who have been through prostate cancer, really struggling with that, and said, you know what, we're going to give back to our community and we're going to tell them not only what it's like, but there's a way out of that. Self-help groups are really important because they're peer-led, so it's for the community, by the community. We really wanted to make people aware of the screening options available to them in the community as well. So we've got Macmillan here talking about bowel cancer screening. We've got a giant colon here where people can walk through and get the information, a really good visual where people can be relaxed about talking about it. The thing I'd like to really achieve from these health roads shows, and specifically from today, is that people start talking about health.
We ask people to look out for the early symptoms of bowel cancer. We're asking them to look out for blood in their poo or from their back passage, any tummy pains or lumps in their tummy that go on for a week or two, or any kind of change in their bowel habits, diarrhoea or constipation. Go and see your GP and get it checked out. So everybody between the ages of 60 and 74 gets a bowel cancer screening kit through the post. It looks like this. It comes every 2 years. They're looking for blood in the poo, which is an early indication of bowel cancer. And it means taking a sample of your own poo at home with the sticks provided, doing that 3 times within a week, putting a smear on twice, 3 times, and it comes with a prepaid envelope, and you seal it back up, send it through, then you'll get a result within a few weeks saying it's all clear, or if there's any concerns, they will call you in for a colonoscopy or to repeat the test. Some people say it's unpleasant because you've got to deal with your own poo, but we say it's a lot less unpleasant than going through cancer treatment or finding out that you've got cancer, and it gives peace of mind. And also what's really important to remember, although it's the second biggest cancer killer in the UK, it's extremely treatable if it's caught early, so it's really important people do their screening kit. This is our inflatable bowel. We use this to promote bowel cancer awareness, a representation of what the inside of the colon looks like. And so if you do have a positive test, or if you go for a colonoscopy, we talk through what they will be looking for, and then we put some facts and figures up there around bowel cancer. And it's just a fun, interactive way to get people talking about what's not always a pleasant subject. Self-help groups are vital because you're talking to people who are in the same situation as yourself, who may have some of the same feelings. Everybody's unique, but we believe that talking about your problems or sharing them, using shared resources, that knowledge that's out there is really vital.
We're known as FAB, which is Friends and Brethren. We find the appropriate name for the day to help friends and brethren, as well as bring awareness.
It's very important to take these things into the community, and that's why we, personally from FAB, that's why we do it. Because we just want to bring awareness about prostate cancer and I suppose bowel cancer and any other cancer. It's very high in the black community. Just for example, it's 1 in 8 in the generic population, but in our community it's 1 in 4, and the death rate is quite high in the BAME community.
Friends and Brethren was set up mainly because of one of our friends, close friend, was diagnosed with prostate. Early screening is very important. So important that it's a matter of life and death. So the earlier you can screen, it's more chance of you curing it.
We are quite proud in all the work that we're doing in the communities. As for us, as a group, we not just do it in local, but we do it nationally. So we're only a small group, but we get around.
My name's Alison Hall and I'm a Macmillan Cancer Information Specialist. We provide support to people affected by cancer in the area. So that can be anyone affected by cancer, people who have been diagnosed, people who are worried about a sign and symptom, or a family or friend of somebody who's affected by cancer. Well, Macmillan and Self Help UK already work really closely together, and it's a good opportunity for us to go out into the local community and show what services and what support we can provide. We find that going out and meeting people face to face is much more rewarding, it gets the word out there, and it's much more effective than simply sending out a leaflet or putting a poster up somewhere. Early screening is really important. The sooner a sign or symptom is picked up and assessed by a medical professional, the earlier treatment can be started. And the sooner we start treatment, the more curable the cancer is. So I would encourage anyone who's offered screening to take it up always. To be able to have that face-to-face contact with people, to give them support, to give them advice, to answer their questions, really helps the local community and helps to raise awareness of the things that we should be looking out for and how we can improve our health and well-being. Macmillan Cancer Support is here to support anybody affected by cancer, whether they've got a sign or symptom, they're a friend or family member of somebody with cancer, or whether they've been diagnosed themselves. And that's at any stage of the cancer journey, whether they're still undergoing treatment or whether they've been cured. The message I would really like people to take away today is that if they have got a concern, if they've got a lump, a bump, a symptom that they've not told anyone about, just tell someone, tell a healthcare professional, tell a family member, go to their GP, because the sooner we can help these people, the sooner we can get whatever it is treated and they can get back to their normal daily life.
The health message is always the same.
Don't be frightened, don't be embarrassed, get yourself checked out.
Plenty of exercise, eat well.
It's much better to get something checked out than sit at home and worrying about it. And that goes for the men especially, because we're the worst.
Let's be well ourselves, spiritually, mentally and physically, and let's do that together as a community.
The event is very nice. I liked it.
Absolutely fantastic. Very well organised, very well structured.
It was absolutely amazing. Some of the information for the health and fitness as well.
It's been a wonderful day.
Astonishing to see so many different stalls from different organisations, and it's astonishing to see how much community services we do have out there available.
Self-help groups are absolutely phenomenal.
Myself, having a lot of interaction with Muslim women, we've made contacts for archery, to set up archery classes for Muslim girls and females. A walking group, which is something that was discussed in our Tuesday brunch club for women, and we've got the contact, so that's going to be going.
They're offering you a platform to come in and actually be able to help others, to make them aware of the types of conditions that are out there and the support that's available out there.
Events like these are really important.
This should be done every month.
I'm glad I actually came along. I've got to learn so much about so much different things. It was lovely.